Welcome back to our five-part series on managing diabetic cataracts in dogs. We're joined by Dr. Kellam Bayley, veterinary ophthalmologist, who's going to tell us a little bit more about once we have diagnosed a cataract, when do we start planning surgery and what does that actually involve?
Yeah, thanks, Carolyn. So, um, the timing of cataract surgery in diabetic dogs is kind of important. Diabetic cataracts can cause quite a lot of inflammation on the inside of the eyes, and and if that inflammation is severe and or has been going on for quite a long time, that
Mm.
can mean that the eyes are become too damaged to do cataract surgery on. And so when it comes to diabetic dogs with cataracts, my preference is always to look at having them assessed and then planning for surgery as soon as reasonably possible. Some other non-diabetic cataracts are much less risky to
Mm.
leave for longer periods of time. But if they're diabetic, they really should be assessed as soon as possible. Because if we leave them too long, we may miss the opportunity to operate. And the tricky thing with that, with diabetic dogs, is that we've got a metabolic issue to consider as well, right? We've got diabetes. And
Oh.
often these dogs, um, uh, their diabetic control may not be ideal. I mean, often they're far from ideal. However, my recommendation is to always have them assessed as soon as possible following cataract formation, whether they're under control or not with the diabetes. From my point of view, I'm happy to operate on diabetic dogs which aren't under perfect control, as long as they're not sick and they don't have anything else going on. We need to have some degree of diabetic control, but they don't need to be perfect. Um, and the reason for that is that while we're waiting and fiddling with the insulin dosing to try and get the diabetic control perfect, we may miss the opportunity to fix these cataracts. So that door does close.
Early intervention is really key, and because we've advanced a lot in our anesthesia as well, even if they're not perfectly controlled, we can still keep them safe and stable enough to handle the surgery.
Part of the preoperative assessment is to determine whether they're a suitable candidate for anesthesia. And obviously, they still need to meet that criteria before operating. But if they don't get the opportunity to have surgery promptly, then they may very well lose the chance to get vision back because the eye undergoes too much damage. Yeah.
So if we've determined that the animal is a really good candidate and I'm the owner bringing it in, like what does it actually look like day of surgery? What happens?
Yeah, so I mean, I'm happy to describe and go through what I do with cataract surgery in dogs. There's no single right way to do cataract surgery. So we'll run through my approach to it. This is the right way for me. But if you happen to have assessment and care with another ophthalmologist, it may very well be different. Well, probably will be different to some degree. But this should give you a pretty good overview of how I go about it and what I think is important. So, well, cataract surgery is a day procedure, so you're usually in for the whole day.
Mhm.
And when it comes to the surgery itself, we have them in early in the morning. We assess what their glucose is like. So we have them in for the day, and they're usually operated on in the morning, so that they've got time to recover after the anaesthesia, and we can monitor their blood glucose throughout the day and just make sure that they're at safe levels. Um, it's a fairly lengthy anaesthetic. So if we're doing bilateral cataract surgery in a diabetic dog, it might be like a 3-hour procedure. And so they take a while to recover from that. Surgery itself, so they have, once they're anaesthetised, they're underneath an operating microscope so that we've got high magnification and we can see what we're doing. And we make a small incision on the side of the eye, just under 3 millimeters in width. We're using an ultrasonic probe to fragment and then suck out the cataractus lens. Once all of the lens material has been cleaned out from in the lens capsule, we then inject an artificial lens into the capsular bag, and that pretty much corrects them back to normal vision. Once the lens has been put in, we stitch the wound close on the eye, give them a series of medications, and then start the recovery process.
So it sounds very similar to actually what they do in managing human cases with diabetic cataracts or just general cataracts.
Yeah, it's quite similar. The big differences between human cataract surgery and veterinary cataract surgery is that veterinary cataract surgery is always done under general anesthesia. The vast majority of human cataract surgery is not done under general anesthesia, done under local anesthesia of some form. So it's very much an outpatient procedure for them. They're incredibly proficient, the human surgeons. and far more proficient than me. They just do so many of them. And so it's very much viewed upon as a relatively minor procedure in the human world, but a fairly major undertaking in the veterinary world because of the time and requirement for general anesthesia.
Mm. And so what does success look like for a cataract surgery?
So I advise people that estimated success rates about 85 to 90% will get restoration of vision in the medium to long term. Another way to look at that is say 1 in 10 to maybe 1 in 8 cases will fail. And failure means loss of vision after cataract surgery. So it's a significant number of failures. Like it's a high success rate procedure, but failures happen. And failures happen in cases which are good candidates before surgery. And so, and the most common cause of failure would be glaucoma. So where the pressure of the fluid inside the eye becomes elevated and it damages
Mm.
the retina and optic nerve. Some dogs will get retinal detachments, which will lead to vision loss. Um, and you can have other opportunities for complications like corneal ulcers would probably be the next most common cause.
So stuff that sounds like it's hard to predict. So the eye can look really good ahead of time, but we just don't know how it's going to respond to having the surgery done on it. Well, most will do well. There's just the chance that even though we're aiming for vision to come back, it might not get to that stage with them.
There are some cases which are less than ideal candidates before surgery. So maybe they've got some scarring in the eye before surgery. Maybe they've had significant inflammation in the eye before surgery. Maybe they've got a risk factor for developing glaucoma. Those cases are higher risk for failure than cases that are ideal candidates. But unfortunately, even in ideal candidates, we still have failures.
So it's about having that realistic expectation. So what does the postoperative period look like? So if I've just come and picked up my dog, what can I expect of the next days or weeks?
So after cataract surgery, so typically I will try and send them home that night. Plan to reassess them the following day. Sometimes I'll stay in overnight, depends on the case. They will go home wearing a cone, so they'll have a plastic cone around their head to prevent them from rubbing their face and rubbing their eye or bumping it. That needs to stay on for 2 weeks. And then I advise that you need to avoid knocks and bumps to the head for a month after surgery. So no balls, sticks, toys, running in and out of dog doors, rough play with children or dogs. Anything that can hit the face or the eyes needs to be avoided for a month after surgery. Depending on the dog, that can be easy or difficult. It's really important because that eye, particularly soon after surgery, is so much more susceptible to damage from minor traumas. It can become very inflamed. Once the eye settles down over a long period of time after surgery, it will become much less prone to over response from a trauma or something like that.
So is that really that
Um,
first loop that's critical in the recovery to make sure everything settles down normally?
well, it is. I mean, we put so much time and effort and money into doing the surgery that we don't want to go out and try to play backyard cricket with them and wreck the eye. Like that would be a really disappointing outcome for everybody. So there is a little bit of wrap the patient in cotton wool, so to speak, for a period of time. That's not forever, but it is important in the immediate postoperative period. We are also on a reasonable number of medications after surgery. So for mine, they'll usually go home with a topical anti-inflammatory, a topical anti-glaucoma eye drop, a topical eye ointment, oral anti-inflammatories, oral antibiotics, and an oral pain reliever. There's quite a few things to do in the first few weeks after surgery, but after that first block of treatment is completed, a lot of medications will run out down, and then you'll just be on that one eye drop. Regarding your comment about pain, the expectation for pain after surgery is that they should either be in no pain or very little pain. Despite it being quite an involved surgery, technically, it actually doesn't cause much damage to the eye at all, and they're usually remarkably comfortable after surgery. And so once once we get started on the post-operative medication, we'll then plan a series of reassessments at increasing intervals afterwards. So we'll usually reassess them, say, 1 day later, maybe half a week later, maybe another week, maybe another week, maybe 2 weeks, maybe 2 weeks, maybe a month, and then just follow them over an extended period of time. as we reduce the frequency of the eye drops and monitor the response. Um, as far as it goes with medication moving forward, it's very common, particularly in diabetic cataract dogs, that they will need to stay on an anti-inflammatory eye drop once or twice a day long term. It's
Oh,
related to their predisposition to having inflammation before surgery because of the diabetic cataract nature. And
mhm.
also the diabetics have got funny immune systems, so they often will become more inflamed than not.
So is a lot of that care done at the local vet? So you make up the plan and send it back, and they'll be following up with them and to manage those checks.
That depends on the location of the patient. So for me here in Hamilton, I have a very large catchment of cataract
Mm,
surgery. So we're kind of Pukekohe to Wellington and everywhere in between. Um, And so for cases which are coming to me from Wellington, for example, or operate on them, they will go back to their own vets. Their vets will be advised by me what I want them
mm,
to do for the reassessments. Then they will communicate back to me what they find. I will review all of that new information and then send out a new treatment plan and reassessment plan. So for cases that aren't directly under my care, I'm still collaborating with the local vets because I can't expect someone to come back to me for all their reassessments if they're a long way away. But that said, the way that I ask the local vets to manage them is well within their ability and their equipment availability to do it, and it's also something that I keep involved in. You know, I don't kind
yeah.
of send them out the door and say, "All right, good luck." Um, yeah, and so cases which are local,
Mm.
I tend to do the reassessments myself, and then we just, plan them as we go. Cases that are having a problem, and if it's possible for them to come back to me, then we plan for them to come back to me to reassess. But it depends on the location. But there is an ability, from my point of view, to manage them either by myself here locally in Hamilton or remotely around the North Island.
I imagine another question a lot of owners will have is how much does all this cost? Because it's quite labor intensive and requires a lot of specialized equipment and training to be able to perform the procedure.
Yeah, so it's pretty expensive surgery to offer, and part of that, or a big part of that, is just the cost of the gear. Like it's
Mm.
quite expensive, but there's a lot of investment in time and all that sort of stuff into it as well. And so, from my point of view, I'm happy to give you a rough cost estimate from my point of view. Again, um, if you're having surgery with somebody else, or if you're having surgery with me, even, I would request an accurate cost estimate. All right, because what I say is, roughly what we're doing now, and it's definitely not going to account for anybody else. Right, they're
Mm.
probably in the same ballpark, but it's I'm definitely not quoting for any other surgeon. And so, for a diabetic cataract, if we're looking at doing both eyes, you're looking around about the $6,500 to $7,000 mark. And so, from my point of view, that's kind of includes all the stuff on the day: medication, surgery, anesthesia, implants, consumables, all of that sort of stuff, including the two lens implants. Um, and the way that I charge these things is that also includes my post-operative management, whether it's in person or remotely. Yeah, so I try to arrange the pricing so it's kind of paid for more or less up front, so that regardless of how much more involvement I have over the months following surgery, I don't like to just keep pinging people for charges. If you're having your reassessments done locally with your local vet, they will charge you as they should for their consult and their time and consumables. But I don't like, I like to sort of get my charging out of the way at the front.
So it sounds like the best course of action is really if you're going ahead with surgery, book an appointment with the surgeon who's going to be doing it, and they'll walk you through everything and what's involved with it to make sure it's tailored to your dog specifically.
Yeah, and it's, don't be afraid to ask for a cost estimate. If you're not sure what cost estimate's going to be, they should be happy to provide you a cost estimate even before a consult. But before proceeding with surgery, they're definitely going to need to have a proper preoperative consult to make sure they're appropriate candidates for surgery.